This is the Global Podcast Network, where executives and professionals connect, share, and inspire. Stay tuned for the conversations that drive success.
Every time we get together with her, it's an education in our bodies, and so important. It's the lymphatic system, and that's a system in our bodies that takes care of waste, sometimes toxins, as I learned. It's not always all toxins. We change our verbiage on that. But we don't really put a lot of emphasis on it and realizing how important it is for the system to flush this stuff out. One of the ways to do that is through certain types of massage to drain the lymphatic fluids from our body. But how do you know you need that? How do you know you might have a challenge with that system in your body? We're going to learn about that today. She's the president and owner of Boone Lymphatics and Massage Therapies. Ann Boone from Kentucky is back with us. How are you doing today?
Yeah, I'm good, Steve. As I mentioned, it looks like we're both back in our studios. We were doing it out of our houses last time due to the weather, the snowmageddon, the ice-mageddon here. Yeah, no, I'm doing well.
It's so funny when you're out of your element. You know, it worked fine last time we got together, but
sure.
And I love, where I reside, but I like being here.
Yes, exactly. We have our workspaces that we feel comfortable in.
It's almost like being in the cockpit of a plane, where
That's right.
You fly in another plane when you're home, and then when you're in your domain, your work domain, a little bit different.
Exactly.
So we identified one of the ways to know that you might have some challenges with lymphatics is maybe the swelling of ankles and things like that. There's a lot of other symptoms there that you might have some challenges going on, right?
Yeah. So the first couple podcasts we talked about the anatomy of the lymphatic system, and we also talked about last time what manual lymphatic drainage is and what it isn't, and recapped the lymphatic system workings. This time I wanted to cover what can happen when the system isn't working correctly and what may be a few of the reasons. So there are several reasons that your lymphatic system may not work the way it should. There are two types of lymphedema is one of the main ways it might show up, and that's swelling. Lymph accumulates in the tissues. We talked about proteins and things like that. So you get chronic swelling. It's usually in the limbs, arms and legs. And we have primary lymphedema and secondary lymphedema. Primary lymphedema is congenital or genetic. You're usually born with it. And there are a few diseases that go along with that, but I won't go down that road right now. Secondary lymphedema, which is more common, is acquired by damage to the lymphatics. So cancer surgery, if lymph nodes are removed, radiation therapy. So sometimes people have a double whammy with breast cancer, they have radiation and lymph nodes removed. Infection, primarily from a parasite called filariasis. And in 2000, 199 million cases in the world, 3.1 in the US, and about 50% globally in Southeast Asia, Indonesia, India, Bangladesh, those areas, Myanmar, and African nations, about 21%, are caused, or cases are there. They're caused by a mosquito biting you, and then the parasite infects your lymphatic system specifically, not your circulatory system. So when this happens, we have swelling and we have a problem. And then trauma is another reason that you might have lymphedema. And that can be from an accident. For myself, I have a little bit of venous insufficiency and a slight amount of lymphedema from a horse flipping over on me and putting my patella out for 7 hours. So the circulation wasn't great there. So I wear a lot of compression.
Can we focus on that for just a minute? Because
sure.
I appreciate your transparency in that. And so you had that accident, that injury, a period of time ago, and you're saying that you still have after effects of that?
Yes, and that's a great question, Steve. The effects. So I've had for myself. This happened in 1986. So I still
Wow.
have to wear a compression hose. And if I didn't, I know, isn't it crazy? So if I didn't wear the compression hose and I stood all day, I'm noticed more swelling or more, for me, it's more pressure and there's a thickening in that tissue. It's not as pliable. And over the years, I've had a lot of lymphatic work and massage therapy and those types of things. Perfect example, I have a client who came to me, had breast cancer surgery. This was 25 years ago, but 22 years before that, had lymph nodes removed, double mastectomy, and was just developing lymphedema in her upper back and arms 22 years later. So you may have no problems at first, but people who have had lymph nodes removed are usually should be advised don't have blood taken in those arms, don't have blood pressure taken on that side, don't have, no puncturing of the arm, no extra pressure on that arm. Gardening, you want to make sure you're wearing gloves so that if you get cuts and things like that, because they are more prone to developing lymphedema when even one lymph node's removed.
Dramatic pause. That's a wake up. I knew that this system in our bodies was important and all of that. Had no idea that decades later you could still have lasting effects. Because now, all of us, I'm sure, thinking back, all right, well, I had that surgery 5 years ago. I had this done. Blah, 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 blah. I'm like, okay. So how would you know that you have after effects in your lymphatic system from procedures and injuries and things like that? Let's dig into that, because that's
right. So that's
crazy.
why we take such a thorough history, medical and health history, to get an idea, because maybe somebody hasn't had the surgery. Another reason someone might have lymphedema is recurrent infections. So it may be that somebody was in a third world country, going back to the filariasis. Usually these infections start as children. So they're bitten by the mosquito. The parasite remains dormant in their lymph system, and then something may cause it to activate, and that's when they have an issue. I have a fellow therapist who, she worked in the stables, horse stables, with sandals on, and was bitten by a mosquito, and it caused one whole leg to blow up and be edematous or swelling because of filariasis, only in one leg.
Amazing. Again,
Yeah.
I'm scanning my history. I'm sure others are. I had some radiation for skin cancer 3 years ago, maybe 4 now, and all the other stuff going on, and injuries, little things here and there, skateboarding, whatever it might be.
Right.
You could still be dealing with these and not even realize it.
That's right. You may be perfectly fine for years. And then, especially, I've had clients with lymph nodes removed. And then maybe one had a very unusual case where she had a strep infection and it moved to her arm and it caused her to have lymphedema of the entire arm. And she had radical mastectomy, a lot of lymph nodes taken out, muscles and everything else, 35 years before. Never had lymphedema.
That's why we're here today.
Yes. So what you're looking for, normally when we see swelling, there could be pitting edema, and that's when you put your finger in and you get an indentation, often in the ankles, usually in the ankles or feet. Now, in later stages, and there are 4 stages of lymphedema, you'll get what's called non-pitting edema, and that is not a good sign. The pitting edema is more of a reversible sign. When we start having skin thickening, which we call orange skin, it looks like an orange peel, heaviness, reduced mobility, and increased infection risk, because your lymphatic system, again, as we talked about, everything moves towards the lymph nodes. They look around and say, oh, there's infection here, we got to take care of it. But if everything is clogged up and backed up, it can't do that. And we do have the 4 stages of lymphedema. Are stage 0, latent. You may never know that you have it. We call it subclinical. The lymphatic transport's impaired, but there's no visible swelling yet. You have normal limb size. You might have some heaviness or tightness or fatigue in the limb. And this can last months to years, as we just talked about, before you see any progression. And so next is stage 1, which is reversible as well. But again, that protein-rich fluid begins to accumulate, and you see swelling that improves with elevation. So if you put your legs up, skin still soft and normal, no permanent issues or changes yet. We then have stage 2. Now that's called spontaneously irreversible. So this is more of a chronic inflammation. You start to have fibrosis in the tissue. So you'll notice that the skin, as I mentioned, you can't push it in. It starts to look like an orange peel. It's very fibrous and not the squishy kind of edema we think about. You get that non-pitting edema. It does not resolve with elevation. So if you put your feet up, it does not resolve. You get this, and we get what's called a positive stemmer sign, STEMMER. If you pull up on the skin of the person's toes, it does not, you can't grab any part of that toe because they're so swollen. Now, extreme examples are stage 3. We call this lymphostatic elephantiasis. And that's when you see these huge limbs, severe lymph stasis or swelling and edema. Adipose also starts to depose in those areas because the fats can't move back to where they need to get to nourish the tissues and get out of the system. So you have massive limb enlargement, severe skin changes, hyperkeratosis, papillomas, all these different growths, very deep skin folds, and recurrent infections are really common. So it's really important with that to get the skin taken care of first, and then they can start to work on bringing that size down. And sometimes they have to do surgery to remove the extra skin once they've done compressive therapies and things like that to bring it down. But that is an extreme example, and hopefully people don't get to that stage. They're also very rarely more prone to cancers because the increased risk of malignancies, it's very rare, but there are lymphangiosarcomas, and that can happen when they get to the stage of, stage 3, where they don't have good transport. So, yeah.
Wow.
I know.
Again, always knew it was an important system in our bodies when I first learned that a few years ago, but not even to this degree.
Yeah.
Wow.
Yeah.
You really need to listen to your body and look at different things that present. And I have to imagine, Ann, that years later, somebody may develop something not connected to the injury or surgery they had, go to the doctor, ask for help. I got this going on, that, and might even get the wrong medications, think, oh, it's just water retention there in your ankles. Oh yeah, here's a med, let's diuretic, let's clean you out, whatever it might be. But they're not addressing the true issue. How would you figure that out, even as a medical practitioner, that it's something with a compromised lymphatic system?
Well, at stage 0, it's hard to. You made the person, as you mentioned, the person might just be feeling heavier, more tired, wake up with swelling in the face and the limbs a little bit that goes away during the day, or if they put their legs up. As a lot of medical practitioners they have a little bit of training in lymphedema or lymphatic system in school, unless that's their specialty. And even oncology, hematology oncology doctors don't deal with that system post-operatively. They'll send them to a physical therapist or to somebody like me who is trained and certified in those methods of dealing with those systems. But many times people will go years and years, and like you say, they'll give them a diuretic. It's a temporary fix, but it doesn't address the reason that the lymphatic system is not working properly. You can also have issues with the intestinal system, and when the lymph drainage is disrupted. So say if somebody has abdominal surgery and they have part of their colon removed, or they have abdominal surgeries that might disrupt the normal draining of the lymphatic system. And this can be from trauma, again, malignancies like lymphoma, And then, as I talked about before, congenital lymphatic defects. So it can also impair lipid, fat, and absorption in your nutrition. So if you have fat malabsorption, you're not able to absorb vitamins A, D, E, and K, which are all fat soluble. And also you'll have inability to absorb the appropriate amount of protein and get rid of excessive protein. So it has to do with our
Wow.
nutrition too. It affects our nutrition and our overall physiology.
And did I hear you right that having lymphatic challenges pop up could inhibit your absorption of vitamins like vitamin K, vitamin D?
Yes.
All right,
Absolutely.
so let's you were transparent. I'm giving it back to you.
Sure.
A year or so ago, I was told I had low vitamin D, the lowest they've ever seen. So now I'm thinking back that I don't know that I genuinely had a problem with my lymphatic system, but I did have radiation for skin cancer. I did have some surgeries a couple of years before. Maybe that all caught up, and it was resolved with the vitamin D, where I took 50,000 units once a week, and slowly that built up the stores of that. Maybe that had something to do with it, because why would it be so low out of nowhere?
Well, there are a couple reasons, and you and I have very similar jobs. We're in a cave working, right?
Yeah, yeah.
So my vitamin D was in the basement as well. And vitamin D needs to be taken with K2. I'm not a nutritionist and I don't play one on a podcast even.
Mhm.
So you do need to, I took D3 by itself, and then I had a practitioner tell me you need to use K2 because those two fat soluble vitamins work together.
Mm,
So it can be a combination of your radiation and these other things affecting your lymphatic system.
sure.
And I would say also the fact that we're not getting out. From what I understand, we have to be out exposing our entire torso 3 times a week without sunscreen on.
Mm.
And of course, at this time of year, that's not happening. But even my husband, who worked on a farm and was exposing his torso, a person like that can be low in vitamin D, and that's important because, not to go down that rabbit hole, but a little bit. Vitamin D is very important because it acts like a steroid hormone, and it's very important for your absorption of calcium, phosphorus, magnesium, and all these other things. So it can create a cascade of issues.
Sure.
But especially if you are inside all the day, like we are, I take a day, and the doctors will prescribe 50,000 once a week. But it's something you want to have monitored every 6 months to a year, to see if you're not getting too much, because it's fat soluble and can build up in your system. But then also you want to make sure that you don't think that, okay, after a year I'm good, I don't need to take it anymore.
I'm due.
And there's also, that a lot of people do that. And also there is a huge, with a lot of the studies that are out there, there's a huge idea that not getting enough vitamin D can also predispose your body to not being able to handle cancer and that type of thing, the initial cells.
And as I learned, vitamin D essential for absorption of other minerals and vitamins, and without it, or proper numbers, you could have brain fog. You could feel lethargic, tired, all of that. I had labs after that, like 6 months or so after, and it seemed to resolve. And that 50K once a week was only for about 6 weeks or something like that. And it just, it built itself up. But eye opener here. Had no idea that the lymphatic system could bring that kind of stuff on. And what do you think maybe the top 3 ways that we could be proactive about supporting our lymphatic system? Maybe something as simple as hydrate. Maybe that'd be one of the, the top 3.
That would be number 1. Yeah. And number 2 would be movement. As I mentioned last time, motion is lotion for the whole body. You need that. We're designed to move. And then I would probably say, I incorporate lymphatic drainage into a lot of my clients' sessions as well. But just being aware of not eating excessive amounts of salt and having as clean a diet as possible. So hydration, making sure that, your nutrition is not subclinical and that it's clean. as well as move your body.
Mm. And the salt intake, is that what we're all thinking here? That it inhibits the flushing of fluids because you're retaining because of the salt?
It becomes too concentrated. So, you think about seawater as compared to pure water. So seawater is very high in saline, and that's not something we can drink and survive.
Sure.
But it just becomes too concentrated, and there's sort of that sweet spot of concentration of proteins and fats and sodium and all those types of things in our body that keeps everything moving smoothly. When you have too much of a concentration of sodium, it's just too hard for other things. The body is just trying to get rid of it. The lymphatic system is trying to rid itself. So just anything becomes too concentrated in the lymphatic system. It has a harder time working in the way that it should.
Wow. When you work with people, obviously the massage portion needs to be done in person, where you're located in the geo of Lexington, Kentucky. Can you support people on a consultation level virtually anywhere?
Well, not so much that, but I do give homework, and we talk about, and we might even be able to talk about this more next time, but it's called the Big Six. And so it's certain 6 different places on the body that they can treat themselves on a daily basis to stimulate lymphatic drainage. And that helps support the work that we do. And then maybe even I'll work in conjunction with PTs, physical therapists, who are doing the bandaging portion for somebody who might have later stages of lymphedema.
Wow. Okay. The most important question here that I've ever asked you, and here it comes. You're from Kentucky.
Now, I'm from California, but I live in Kentucky.
Oh, that answers that. There's no accent.
Right. Now, when I go back to California, they think I have an accent because sometimes I'll say y'all or, bye.
That's so funny. Wow.
No, I'm a California girl.
Okay. I'm going to ask. I'm kind of curious. What brought you to Kentucky? Beautiful place.
I met my husband at a horse sale. I was working with horses at that time in California. And I went to Alaska for 10 months, and he was persistent. So I ended up back here, and then we went to New York to Belmont for 4 years.
Oh, Belmont. Yes. A lot of changes in the New York area involving Belmont. Just a side question. Horses, lymphatic system, that needs to be supported just like humans?
Absolutely. There isn't, what you'll see with horses mainly, and will be swelling in the legs from different injuries or overuse. And racehorses have a lot of bandaging, especially racehorses who are performing at a high level and have the money. The owners have the money to do this, but
sure.
They will have red light therapy. They will have electromagnetic field energy, pulsed electromagnetic field devices, rather. They will have compression bandaging for their legs if they're having swelling. They'll have massage. They're treated a lot better than a lot of the people who work on the track. So, yeah. And so,
well, they're stars. They're sports stars in some regards.
There's a lot of money involved.
Exactly right. Thank you so much for the insight. What's your website?
It is BooneMassageTherapy.com. That's BooneMassageTherapy.com. And the phone number is 859-209-9005. And that's our virtual receptionist.
What a wake up today. Again, I've always said, since I learned a few years ago, how important this is in our bodies. We just took it to new levels here, knowing that things that happened years ago could present within our lymphatic system now. Wow.
That's right.
Amazing.
That's right. We are dynamic. We're not static.
I appreciate and we should keep moving
That's right.
as we learn here. And thank you so much. I appreciate it. We'll talk soon.
This is the Global Podcast Network, where executives and professionals connect, share, and inspire. Stay tuned for the conversations that drive success.